Here with you live on this page, Diabetes Youth in Action. Hello, hi all. So, hi Devank, hi Aman, hi Rituraj. Okay, so let me introduce myself here. So my name is Dr. Ritisha Nagar. I am a psychologist and I'm assistant professor of psychology at Kamala Nehru College, University of Delhi. I also happen to be a type 1 diabetic since the last 10 years, and I'm here to interact with you to talk about how to take care of your mental health during the lockdown and self-isolation period. So, well, many of you may have heard about WHO that has been giving a lot of advisories and instructions about how to take care of your physical health. WHO has also been very concerned about the mental health of individuals, across the globe. In fact, WHO said that, this period that we're in, it's probably not going to be a sprint, it's going to be a marathon. In short, we are here for a long time. So it is very advisable for us to have a conversation regarding not only how to take care of our physical health, but also about our mental health. So we are living in a very strange and unpredictable and unique times. ऐसा कभी हमारे साथ पहले हुआ नहीं है और hopefully शायद ऐसा आगे होगा भी नहीं. So this period of isolation, physical distancing from people that we love, closing down of schools, colleges, of our workplaces, for many of us that has led to a lot of heightened and increased stress. Many of us are probably experiencing irritation, anger, frustration, hopelessness. And I think some of the reasons why we are going through and experiencing these, abundant negative emotions is that, there's intense unpredictability. We are afraid and unsure if we're going to be affected by COVID-19. We are afraid of the fact that maybe someone that we love may be affected by COVID-19. Many of us may also be going through financial hardships during this time because the last couple of weeks we've seen some people being laid off, some people haven't gotten their salaries, or even if let's say we're not going through that, but there's always a question mark about what next, what about future. So there's a lot of uncertainty that is there overall in this period, and that uncertainty and unpredictability has again made us experience certain emotions that probably we don't know what to do about and how to handle them. So that's what I'm here for. Please feel free to write your questions, your comments, your suggestions, your feedback about the session. Maybe you can do this right now, you can do this later, and I'll pick it up as we move along. Now, research has stated that people who are quarantined, they're likely to experience a wide range of negative symptoms, including low mood, insomnia, नींद नहीं आना, चिड़चिड़ापन होना, घबराहट होना, थकान होना, लो फील करना, डिप्रेशन और पोस्ट ट्रॉमेटिक टाइप सिम्टम्स. इनफैक्ट जो लो मूड, नेगेटिव मूड है या चिड़चिड़ापन है, वो सबसे ज़्यादा कॉमनली देखा गया है इन पीपल हु बीन आस्क्ड टू quarantine themselves and isolate themselves. Now, there are some people who are more vulnerable to not just physical symptoms of COVID-19, to experience COVID-19, but also they're more vulnerable to psychological distress during this period. And some of those people are women, because of the multiple roles and responsibilities that they're facing, they experience. Some of us are working and we're also managing household. Thankfully, there are a lot of people, family members have come together and contributed to the household work. But also others who are probably experiencing heightened stress in this period are parents with young kids, young children, and also type 1 diabetic people. Diabetes in general, but since this is a group for type 1 diabetes people, so we're going to be talking more about that. Well, it's not news, ऐसा कोई नया news नहीं है हम लोगों के लिए कि भाई अगर that we are more prone to many diseases and disorders compared to the rest of the population. This is not brand new information for us, but still knowing that diabetes makes us prone to this new virus obviously has created a lot of anxiety amongst people with diabetes and of course their family members. So I'm going to be talking about what can we do here, some simple maybe tips to tell you how to manage this period well, to help to work on our mental health. Maybe some of us are already working on our physical health, but how can we work better on our mental health? So सबसे पहली बात यह है कि एंग्जाइटी तब होती है कि जब हमारे पास, आपने देखा होगा कि घबराहट एकदम से शुरू हो जाती है आपको, शायद जब आपके पास कुछ ऐसे फॉरवर्ड आते हैं या कुछ ऐसा न्यूज़ आती है कि एकदम से लगता है कि ओ माय गॉड कि इतने केसेस बढ़ गए हैं और इतने लोगों को हो गए, तभी आपने देखा होगा कि लोगों में पैनिक में आके बहुत ज़्यादा जाके वो होर्ड करने लग जाते हैं सामान, या मार्केट जाके बहुत सारी चीज़ें खरीद आते हैं, क्योंकि इतनी पैनिक होती है कि क्या करें। तो उनको लगता है कि इस सिचुएशन में जाके सामान खरीद लेना कि आगे का पता नहीं क्या हो क्या नहीं हो, इवन दो गवर्नमेंट हैज़ बीन गिविंग एडवाइजरीज कि इसकी ज़रूरत नहीं है, we will not run out of essentials and government has been assuring us of that, but बहुत सारे लोग इस तरह की घबराहट और पैनिक में आके पैनिक बाइंग करने लग गए हैं। So सबसे पहला ये है कि जो आपका इन्फॉर्मेशन आपको मिले, यू नीड टू स्टे इन्फॉर्म्ड, बट किसी ने ये नहीं बोला कि हर 5 मिनट आपको मतलब अपना फ़ोन चेक करना है, अपना न्यूज़ चेक करना है कि क्या हो रहा है कोविड-19 के रिगार्डिंग। हर 5 मिनट में न्यूज़ चेक करने की ज़रूरत नहीं है। स्टे इन्फॉर्म्ड, limit your timing, limit the times that you are checking the news. So for instance, आपको दिन में अगर आपको 2 बार न्यूज़ चेक करनी है तो आप टाइम सेट कर लीजिए कि इस टाइम और इस टाइम में अपना न्यूज़ चेक करूंगी रिगार्डिंग दिस पैंडेमिक सिचुएशन, एंड नॉट एवरी सिंगल डे, because like I said that news coming from multiple different sources, some of them are accurate, some of them are not accurate. They can just help, they can create a lot of physiological arousal in us, and then we don't know what to do with that. Stick to trustworthy news sources. अगर आपको कुछ ग्रुप्स ऐसे हैं आपके व्हाट्सएप पे जो आपको काफ़ी ज़्यादा ऐसी इन्फॉर्मेशन जहाँ पे शेयर की जा रही है जो शायद सही भी हो लेकिन आपको परेशान कर देते हैं या आपको घबराहट दे देते हैं, तो यू वेल विद इन योर राइट्स टू वॉक आउट ऑफ दैट ग्रुप और पुट दैट ग्रुप ऑन साइलेंट, और नॉट चेक योर ओन व्हाट्सएप फॉर मे बी 4-5 hours, 6 hours, जितना भी आपको लगे कि आपको ज़रूरत है। तो दैट इज समथिंग दैट ओनली यू कैन डिसाइड कि what are some of the people, some of the groups, some of the social media sources that you want to stay away from. Next, also as responsible citizens and responsible human beings, please evaluate all the information that you are receiving before you share it. Don't just share unverified information forward पे forward आपने कर दिया है तो आप अपने आप को भी anxious कर रहे हैं और आप दूसरे लोगों को भी anxious कर रहे हैं उस चीज़ में। Next is anxiety essentially comes from an intense sense of not feeling in control, और वो शायद सबको लग रहा है इस वक्त unpredictability इतनी ज़्यादा है कि कब लॉकडाउन ख़त्म होगा, कब ये कोविड-19 पे के ऊपर हम कंट्रोल कर पाएंगे, मेरी जॉब का क्या होगा, एग्ज़ाम का क्या होगा। सो इस समय आई डोंट थिंक एनीवन इज़ देयर जिसको ये इस चीज़ के जवाब एक्यूरेटली पता है कि ये कब ख़त्म होगा और कब सब चीज़ें नॉर्मल हो जाएंगी वापस। सो इन दिस very genuinely uncontrollable situation, what is advisable is for us to try to get back in control by doing certain activities, or maybe through certain by following certain simple things we can, or trying to do certain being in certain situations where we can feel in control, more in control, because obviously outside world को तो हम control नहीं कर पा रहे हैं। तो how do we control our lives better? सबसे पहली बात तो listen to the guidelines that have been given by the government, by trusted bodies like WHO, by ICMR. तो जो ये गाइडलाइंस आपको दी जा रही हैं कि हाथ धोने हैं या सोशल फिजिकल डिस्टेंसिंग लोगों से रखना है और मास्क लगाना है, तो इसको स्ट्रिक्टली फॉलो करें। सेकेंड इज जस्ट बिकॉज आप घर पे हैं तो इसका ये मतलब, और आपका जो लाइफ है जो एकदम अपसाइड डाउन हो गई है, तो इसका ये मतलब नहीं है कि आप एक रूटीन नहीं बना सकते, या रूटीन अगर बनाया है तो उसको you're not being able to stick to it. So getting up on time, sleeping on time, having your daily meals on time, exercise का time, study का time, work का time, maybe treating weekends as weekends and weekdays. Some of us are of course working also, working from home. So designated time for work. So keeping a routine right now can actually keep our sanity intact. Second, if it helps, प्लीज क्रिएट सम गोल्स दैट इस दिन में मुझे आज इतना करना है काम, जो आपको अप्रोप्रिएट लगते हैं. डू नॉट हैव गोल्स दैट यू कैन नॉट मैनेज, बिकॉज अगेन फिर आप वो नहीं फुलफिल कर पाएंगे, फिर आपको और यूजलेस, वर्थलेस, होपलेसनेस फील होगा एट द एंड ऑफ द डे, क्रिएटिंग अ साइकिल ऑफ अगेन नेगेटिव इमोशंस. And next is taking out time for exercising. This again, people with diabetes probably know better than than most other people, because we've been constantly and regularly, some of us are in the practice of regularly exercising. But let's not forget that. So maybe some of us like to exercise outside in the park, going to the gym, etc. And some of us are, therefore now we are feeling a little restricted in terms of what are some of the exercises that we can do. But still, if you see online videos, there are a lot of creative avenues here. So some of us can dance, there's skipping available, there's yoga, there's meditation, there's workout sessions that people are giving online. Some of them are freely available. So please engage in that. Do not forget to because I, for instance, have found that I used to walk a lot. And through walking, I could manage a lot of my sugar levels. In fact, touchwood, in the last 10 years, I don't think my A1Cs have gone above 7.5. So, but not being able to walk, even maybe walking on a terrace doesn't feel the same. It has of course led to very high sugar levels, fasting, especially fasting. But so then I realized that no, I have to innovate. So I've been doing workout sessions now. Then I've walked on my terrace a lot. It doesn't feel the same, of course, but then you have to innovate. And so try to find out what are some of the enjoyable ways of continuing our exercise regime. Next is activities. Now बहुत सारे लोगों ने मुझसे क्वेश्चन पूछा कि हम क्या करें, लॉकडाउन के टाइम हम क्या करें, स्पेशली यंग स्टूडेंट्स हु आई टीच, कि मैम क्या करें हम लोग. सो सबसे पहली बात यह है कि लॉकडाउन है, ये कॉम्पिटिशन नहीं है कि आपको एक कोई मेडल मिलने वाला है कि आपने इतनी सारी हॉबीज पिकअप कर ली और अपने इतनी सारी एक्टिविटीज कर ली. I think we need to be kind to ourselves to understand that these are very unprecedented times. किसी ने ऐसा देखा नहीं था. ये कुछ लोगों के लिए काफ़ी ट्रॉमेटाइजिंग टाइम भी हो सकता है, क्योंकि एग्ज़ाम कब होंगे, नहीं होंगे, पढ़ाई ठीक से नहीं हो पा रही, ऑनलाइन क्लासेस नॉट द सेम. मे बी अगेन फॉर पीपल हु आर वर्किंग प्रोफेशनल्स, देन नॉट नोइंग इफ यू विल हैव योर job at the end of the day or not. So these can be very stressful times. So whatever activities help you, please do not compare yourself to an Instagram personality or person who's probably whipping up these nice dishes और पता नहीं कितनी एक्सरसाइज हो रही है और आपको लगने लग जाए कि मैं ही कुछ नहीं कर रही हूँ. तो जो आपको अच्छा लगे. So many people are definitely picking up new hobbies, painting, dancing, music, spending quality time with their children, reading with your children, new books, discovering new books. So anything and everything can be done. What we needs to be understood is that this is a historical pausing that of the world. That's probably not going to happen ever again. So cleaning, बचपन की फोटोज निकाल के आपको चाइल्डहुड फोटोज अपनी देखनी है, सॉर्ट आउट करनी है उनको. कुछ ऐसा चीजें जो आपको हमेशा लगता था कि जब टाइम मिलेगा तो करेंगे, लेकिन कभी मिलता नहीं था. So anything and everything, I would say the sky is the limit over here. But yes, one thing is कि अपने माइंड को एक्सरसाइज करते रहें. जैसे फिजिकल एक्सरसाइज, तो मेंटली आप अपना एक्टिव रहें. So do not choose activities that will make you very passive or will make you very dull. So crossword puzzles, sudokus, reading books, writing something is advisable. Yes, of course, everyone enjoys Netflix, everyone enjoys Amazon Prime or TV shows and binging on TV shows. But please check on that and please limit that, because that can make your mind very extremely dull, and then again will lead to negative emotions like exhaustion and feeling useless and feeling like you've not done anything during this time. Next is that physical isolation does not necessarily mean social isolation. And this is something that mental health experts have been emphasizing time and again. So आपको लोगों से फिजिकल दूरी बना के रखनी है. But socially, thankfully technology has advanced to the level where we can continuously be in touch through video conferencing, through WhatsApp calls, through WhatsApp messages, through chats. We can constantly be in touch with our near and dear ones. Now, like yesterday, I was talking to someone who said that I haven't been in touch with a lot of people and people have been messaging me, where are you? And also, it's if you feel that at this point of time there are only these few people you want to be in touch with, which is what we call the inner circle, and there are very few people in your inner circle. They're your family, they're your friends. Even amongst your family, you could have few people that you're close to, and not everyone. So you shouldn't feel guilty that you need to be in touch with everyone, all people in your circle, all your acquaintances. But if you feel like it, sure, go ahead. So connecting with others during this time, maybe keeping maybe oh, listen, let's chat on Sunday evening 5 o'clock. Let's all get together, family, group, cousin. We'll meet on Zoom, or we'll meet here and there, but online, of course, avenues. That would be very helpful. It will help you de-stress. It will help you not feel alone and isolated. It will help. It basically, connecting with others is a very basic human need, and it usually leads to release of these good feel good hormones. And the silver lining maybe in this crisis can be, many of us have reconnected with our old friends, people that we didn't get time to talk to, family members. And now that we're forced to, we don't have anything better to do. So the silver lining in this pandemic situation could be that it can help you improve your relationship with your near and dear ones. Now, where social media is concerned, social media is a double-edged sword. It can help you connect with people, constantly in touch with people. So if someone who's living maybe in US or UK, etc., you can still be in touch with them. But at the same time, it's also something that can trigger your anxiety. घबराहट बहुत ज़्यादा शुरू हो सकती है, क्योंकि सोशल मीडिया पे unverified information चलती है. Then there are a lot of people sharing so much of information that personally you can find very stressful. Our minds are not made for the kind of overload of information that is doing round, especially during this kind of a crisis situation. जो है कि if you feel that there are people who are sharing information that always triggers you. Triggers मतलब एकदम से अजीब सा लग जाना, घबराहट शुरू हो जाना, या एंजाइटी की एक्सपीरियंस होने लग जाना, स्ट्रेस हो जाना, उसके बारे में आप फिर रुमिनेट करते रहते हो जो इन्फॉर्मेशन शेयर करेंगे. देन you should feel free to tell these people that listen, let's not share all of these kind of information. अगर आप करनी है पर्सनली वन ऑन वन करो, प्लीज ग्रुप पे ना करो, कि काफी इफेक्ट होता है. या आपको अगर लगता है कि यू डोंट वांट टू टॉक, देन प्लीज फील फ्री टू ब्लॉक. लाइक आई थिंक आई शेयर्ड दैट ऑल्सो पहले भी. तो अगर आपको अनवेरीफाइड अनसाइंटिफिक इंफॉर्मेशन मिल रही है कि घंटी बजाने से ऐसा होगा और आपको दिया जलाने से ऐसा होगा, सो ये अनसाइंटिफिक अनवेरीफाइड इंफॉर्मेशन है जो कि दैट कैन डू मोर हार्म देन गुड. So please feel free to use social media very smartly, okay, in a way that is going to protect your mental health. Next is, बहुत सारे लोगों को ये भी मैंने सुना है कि घर पे लड़ाइयाँ ज़्यादा हो रही हैं और चिड़चिड़ापन. People in general, family members have become very irritable with each other during this time. So to that end, I would like to say that देखो ये ऐसा टाइम है कि हम कोई भी इसमें एक्सपर्ट नहीं है, किसी को भी नहीं पता अभी कि क्या होगा, कैसे होगा. We don't have all of this information in our hand. So all of us are actually going through this for the first time. So maybe cultivating a little empathy for each other and understanding that we're all trying our best, helping each other out. So if you have one person who was majorly doing the housework, then helping each other out, and which I've seen very nicely. पहले जैसे for instance, men were not used to doing a lot of housework. Housework was just relegated to women of the household, unfortunately. Now thankfully I'm finding a lot of men, women, children contributing to the household. कि अच्छा ये मैं आज झाड़ू पोछा मैं करूंगी, या मेरा काम है, मेरी ड्यूटी है, और आप ये करोगे, और खाने बनाने की इसकी ड्यूटी है. तो let's get together as a family during these times. Understand that be kind to ourselves, be kind to other people. Take out time to talk about how we're feeling in this time as a family. कैसा feel हो रहा है? Then sharing of these emotions with being able to be vulnerable, express our anxieties to the people that are closest to us can really bring us together. Can help us together kind of come out of these tumultuous times. Last thing that I wanted to talk about is something very interesting thing that I read recently in the New York Times. The article that said that in these times, try to find meaning and not happiness. What this means is that to fight with your negative emotions, perhaps it may not be very effective for you to try to do things that you feel will make you happy. Instead, try to do things that you feel are going to make you feel useful, purposeful, that मैं कुछ ऐसा काम कर रही हूँ कि जो that is contributing and helping others also in this particular situation. So of course all of us know the mental health professionals, law enforcement officers, nurses, etc. All of these people are of course on the front lines, and they're doing a very courageous task or in handling this this crisis. But we ourselves, we can also contribute, and that in turn can help us feel like we are in control of the situation. So what are some of the things that we can do to contribute? Many of us are actually volunteering in terms, or engaging in charity work. So some of us are feeding the dogs, the street dogs. Some of us are contributing money wise. We're giving to some organization, and we are helping out in whatever ways. So so for instance, my mother, who's a yoga teacher, she conducted a session recently for people, for this group, Diabetes Youth in Action. So if you are a gym trainer, if you're good with music, if you're good with maybe dancing, so try to identify what are your skills and how is it that you can use your skills in these times to connect with other people and to help them out. Maybe if you're good with cooking, you could hold a cooking session for maybe the 100 people who follow you. So maybe it will just benefit 2 or 3 people, but at least you'll feel that you're doing something useful, that you're doing. The idea is to not feel isolated even in the times of physical isolation, to connect with other people, to feel a sense of togetherness, to feel hopeful and resilient in the future, for the future actually. So these are some of the things that I wanted to discuss with you people. Now I've had this one question that has come, which I want to address, कि anxiety को कैसे handle करना है? How do I handle anxiety? Because anxiety is one of the most prominent emotions, if you can call it, or it's one of the most prominent experiences that people are going through in these times. Now how do you handle anxiety? सबसे पहला तो we've all, as psychologists, we would say some amount of anxiety and some amount of stress is good. क्योंकि अगर हमारे पास stress और anxiety ना हो तो हम लोग, we will not be washing our hands, we will not be following any precautions, we'll not be let's say we'll not be following what the doctors are telling us to. We'll not be isolating ourselves. We'll be out on the streets because हमें किसी बात का डर ही नहीं है. तो कुछ some amount of anxiety is definitely good for us to keep ourselves protected in this time. But excessive anxiety can be very debilitating, and it can be a very negative experience. It can make us feel very unproductive and out of control. So one of the things, while you're experiencing some of the things that I've said before this, help us to not get into an excessive anxiety mode, such as controlling the amount of information that is coming to us, controlling the kind of information that is coming to us, staying connected with people during these times. So these are some of the things that can prevent you from becoming anxious. But once you are in that anxiety mode, तो अब क्या किया जाए? So some of the tips that I want to share over here is a deep breathing exercise, which is called a 4-7-8 technique. 4-7-8 technique means 4, 7 and 8 are the counts that you need to do while you're breathing. So when you take in breath, you can practice this with me right now. So take in a deep breath and hold it for 4. So count 4 in your hold, 1, 2, 3, 4, and then 7. So count 1, 2, 3, 4, 5, 6, 7. And once you've left, then count till 8. 1, 2, 3, 4, 5, 6, 7, 8. So again you will go. So I'm going to show you now. You can count in your head. So this is a deep breathing exercise that you can do for 5 minutes, and you'll probably feel instantly calm. Some of us do tend to feel, after deep breathing, you'll feel very, very calm. Okay. This can help you in the times, if you're feeling extremely anxious, it can help you calm down and relax. And once you've calmed down and relaxed and you've reached that level where you can talk to yourself, where you're not in a mode where you can't even think anymore. So once you've reached that level where you calm, check your negative thoughts. Check what triggered this situation. Check what led to, क्या आप सोच रहे थे ऐसा कि आपको बहुत ज़्यादा घबराहट होने लग गई. Most of the times we are going through negative, jumping to conclusion. ऐसा हो गया तो, वैसा हो गया तो, ये हो गया तो, वो हो गया तो generally आपके इस तरीके के thoughts होते हैं जो आपको एंग्जाइटी की सिचुएशन में डाल देंगे. तो उसमें आपको फैक्ट्स और वर्स्ट केस सिनारियोस चेक करने. जनरली आप देखेंगे कि आपने वर्स्ट केस, यू जंप टू अ वर्स्ट केस की अगर मैं मर गई तो, अगर मेरी जॉब छूट गई तो, अगर सो यू जनरली यू विल फाइंड दैट यू आर मेकिंग दीज यू सराउंडिंग योरसेल्फ विद दीज वेरी नेगेटिव, एक्सेसिवली नेगेटिव थॉट्स, जिसको अगर आप चेक करें, बाय चेक आई मीन व्हाट इज द प्रोबेबिलिटी ऑफ दिस हैपनिंग. अगर ऐसा हो भी गया तो फिर मैं क्या करूंगी, प्लान आपका कि ऐसा भी कर सकते हैं, एंड रियलिस्टिक प्लान्स ऑफ कोर्स. Arm yourself, I would say arm yourself with statistics and facts. By that I mean, so for instance, telling yourself, okay, 80% of the 70-60% of the people, for instance, are going to experience only mild symptoms. So I'm not going to necessarily experience, even if something like this happens. So it's reading, and these statistics should not come, again I'm emphasizing, should come from verified sources and not just random sources. Okay. Yoga and meditation are very good techniques, are very good exercise modes, are very good, I would say, it's a very good activity to engage in for preventing anxiety in the long run. And then last thing that I would say about anxiety is ki if you have anxiety about things that can't be helped, then engage in feel good activities. Feel good activities मतलब मूवी देख ली, टीवी देख लिया, या एक्सरसाइज कर ली, या something that helps you feel good, your emotions, okay, in check. But if you have anxiety about the things that can be helped, such as काम सबमिट करना है, पढ़ाई करनी है, या फिर anything else that you feel that is controllable, that you can do, then make a list, set goals, set realistic goals and get on with it. क्योंकि प्रोक्रेस्टिनेशन, छोड़ना, रहने देना, नहीं करना, उससे और एंग्जाइटी होगी. सो थिंग्स दैट कैन बी हेल्प, टू डू लिस्ट बनाओ एंड गेट डाउन टू इट. एंड थिंग्स दैट कैन नॉट बी हेल्प्ड, देन फील गुड एक्टिविटी, डिस्ट्रैक्ट योरसेल्फ एंड फील गुड एक्टिविटीज. सो दीज आर सम ऑफ द थिंग्स दैट आई वांटेड टू शेयर, दैट आई वांटेड टू talk to you as a psychologist. Now I'm going to go through, please feel free to write a few questions. I'll probably take a few questions and address them. So I'm going to go through some of the questions that were written. Okay. Yes, this is the best time to strengthen your bond with your family. Yes, I think rather than seeing this as a कि मुझे ज़बरदस्ती जेल में बंद करके रख दिया है, see this as an opportunity that you'll hopefully never experience in your life ever again. Where you will be, and some of us are very privileged. We need to also check our privileges. At least, even when I talk about, I've spoken this on somewhere else, that physical distancing is a privilege. Because many of us, India में इतनी सारी families हैं जो कि एक कमरे में रह रही हैं, 5-6 लोग, जिसमें physical distancing is just not possible. So many of us are in India currently cannot even afford physical distancing because we are living in very close clusters with each other because we can't afford these big houses. So if you're able to physically distance yourself from others, if you don't have to worry कि आपका next खाना, next meal कहाँ से आने वाला है, then I think sometimes checking our privileges also helps us to relax and make us feel that we are not in the worst of situation. Yeah, so at the same time I'm not delegitimizing, I'm not belittling your emotions that you may be feeling. So yes, this is an opportunity that's been, we can't help it, it's been given to us, perhaps, if you want to see it this way, the silver lining to strengthen our bonds and connect with our families that we haven't in a long time. Those who grew up in small villages, cities where people already face so many tough times, they are easily coping with the situation very well. People from villages are mentally strong. No, I don't think so. I think I disagree with you. And the reason I disagree is that I think there is a misconception that people belonging to low socioeconomic classes are more mentally resilient than upper class or upper middle class. ऐसा नहीं है. I think अगर आपने statistics देखे हों तो US में there are significantly more deaths in neighborhoods that are overwhelmingly dominated by black people or Latino people generally, and people belonging to low socioeconomic status. And the reason for that is that villages में, गांव में या फिर छोटे शहरों में हेल्थ केयर सर्विसेज नहीं हैं. अभी मैं एक वीडियो देख रही थी जहाँ पे अगेन आई हैव नॉट वेरीफाइड दिस वीडियो, बट there was a woman who lost her child because she was not able to, in the lockdown situation, she was not able to access doctor or ambulance or even a car to take her child to a hospital. So in these circumstances, I think as it would not be wise in general, I would say it would not be wise to compare suffering. You can check your privileges and feel good कि अच्छा, we're not in that bad situation. अगर आप for instance देखो, so many migrants were stuck. There were migrant laborers who were walking for kilometers, hundreds of kilometers. So are they resilient, or do they have no choice but to be resilient in this situation? आपको एक रिक्शा पुलर दिखाई देगा जो बोल रहा है कि you may have read these interviews जहाँ पे बोल रहे हैं कि भाई कोरोना वायरस से पहले हमें गरीबी मार देगी. तो आप इनको रेजिलेंट नहीं बोल सकते. दे हैव नो चॉइस बट टू गेट अप एवरी मॉर्निंग, बिकॉज अगर वो नहीं काम करेंगे या नहीं कोप करेंगे तो वो मर जाएंगे. सो दैट द चॉइस दैट दे अनफॉर्चुनेटली दे हैव इज coping or dying, and I don't think that's really fair. So again, at the end of the day, Bhumesh, this is what I would like to say, that in this time I think it would be best for us to be kind and empathetic to everyone, because this situation is not about religions. This situation is not about poor versus rich, one religion versus another religion. This is not about one country versus China versus India or China versus the rest of the world. This is not about that. This is about humanity sticking together, helping each other in whatever way possible, so that because we're all going to survive as a group. If we start selfishly thinking about just ourselves, our religion, our community, our country, then I don't think this is going to be the way through which we're going to mentally or even physically come out of it, this entire situation. Well, any other question? It is best time to strengthen our patience, stability. Yes, reading, meditation, spirituality. I agree. Bhumesh, I get off WhatsApp and keep my phone away to get rid of anxiety initiators. Same. I think I've logged out of Facebook. I have gotten out of certain groups. I've put certain groups on silent, and I do not feel guilty about doing this. This is to preserve and protect my own mental health, and I will not feel apologetic about it. And I think all of us need to understand that even if we might be the people who are sending these oversharing information that may be putting other people at risk, maybe making other people very anxious. So we need to evaluate, are we those people who are probably creating anxiety other people? And secondly, if we are ourselves feeling, so ऐसा होता है कि लोग forward इसलिए भी करते हैं क्योंकि anxiety में कुछ ना कुछ करते रहो तो लगता है कि कुछ कर रहे हो. So for example, मैंने आपको बोला panic buying. आपने खाना होल्ड कर लिया है तो कुछ कर रहे हो तो लगता है कि मतलब एंजाइटी पे कंट्रोल कर रहे हो, बट दिस इज नॉट द राइट वे. देयर आर अदर वेज ऑफ कंट्रोलिंग एंजाइटी, बट व्हाट्सएप फॉरवर्ड्स और लगातार फॉरवर्ड आपने, एंड स्पेशली द वेरी क्वेश्चनेबल न्यूज, तो दैट्स नॉट गोइंग टू बी वेरी हेल्पफुल. I only check COVID data once a day, helps me with lowering my anxiety. Yes, Karthik, I think I agree with you. That is a very good way to do it. Okay, sleeplessness, restlessness increases anxiety. Any other questions? I'm going down now if there are any other questions that are there. What if your to-do list gives you anxiety? So Sahil has asked this question, what if your to-do list gives you anxiety? then reevaluate your to-do list कि आपने कितने चीज़ें डाल दी हैं. गोल सेटिंग का ट्रिक ये है कि यू नीड टू हैव अ रियलिस्टिक गोल. You need to set realistic goals. You need to if you're making let's say a 10 item list, ये भी करना आज, ये भी करना, ये. So for instance बहुत लोगों का गोल है कि इस क्वारंटाइन के ख़त्म होते होते मैंने डांसिंग सीख लेनी है, मैंने लेट्स से मैंने कुकिंग सीख लेनी है, मैंने शेफ बन जाना है. सो सम पीपल, सो इफ यू हैव अ टू डू लिस्ट दैट मे समटाइम्स इट मे हैव अनरियलिस्टिक goals. So evaluate yourself. So for instance, for me, I know I can do these 2 things. So today I'm going to just do these 2 things and I'm going to feel good. So क्या होता है कि आपने बहुत सारी चीज़ें बना ली है, तो लिस्ट बनाते बनाते लगता है कि वाओ, I'm going to be, because लिस्ट बन गई है तो अब ये काम हो गया हो जाना चाहिए, और इसलिए फिर आपको अच्छा भी लगता है लिस्ट बनने के बाद. बट व्हेन इट कम्स टू इम्प्लीमेंटिंग द लिस्ट, यू मे फाइंड योर सेल्फ फॉलिंग शॉर्ट. एंड उसमें फिर आप अगर 2 चीजें ही कर पाते हो तो आपको बहुत बुरा लगता है. इंस्टेड ऑफ फीलिंग गुड दैट यू डन दोस 2 थिंग्स आउट ऑफ दोस 10 थिंग्स, यू एक्चुअली एंड अप फीलिंग बैड. सो द आइडिया इसकी 3 कर बनाओ, तो 2 करोगे तो अच्छा लगेगा. तो आई वुड से दैट्स द वे ऑफ हैंडलिंग इफ योर टू डू लिस्ट इज गिविंग यू एंग्जाइटी. What will be the first thing, or how to instantly calm yourself if you have excessive problem of anxiety? Okay, Avi. So I've already shared few tricks. Deep breathing, for instance, मैंने आपको 4-7-8 वाली टेक्निक बताई है. तो I'll save this video. Maybe you can go back and check out that deep breathing exercise. एक और चीज़ है जिसको बोलते हैं ग्राउंडिंग हम लोग. Grounding technique. Now grounding technique means कि when you are experiencing any kind of excessive and overwhelmingly negative emotion, तो उस चीज में अगर आप अपने grounding your sense organs in different activities. So मैं आपको example देती हूँ, maybe you'll understand this better. कि for instance putting your hand under water, पहले cold and then थोड़ा सा warm, and then feeling the water fall on your hand. So experiencing it, feeling the change in the temperature also. So this is an activity where you are activating your tactile senses, the touch sense. Similarly, maybe when you're feeling extremely anxious, try to focus on let's say the birds chirping around. Try to ground yourself in your immediate environment, or for that matter, I will look at the colors of the curtain and I'll try to examine. Maybe this is sounding a little silly to you, but maybe I'll look at the colors and then I'll try to think of, okay, this is deep brown, this is a very nice shade of brown, and try to think about it. Or for that matter, maybe this will activate your visual sense. Then try to eat something really nice and try to savor it, कि उसकी smell, उसका how it tastes. So what it does is that you are able to bring yourself to and ground yourself to the immediate environment, and this can help you in the moment. Again, for some people, again, अगर मैंने आपको ये एक्टिविटी बताई, आप कर रहे हैं और आपको लग रहा है कि ये मेरे लिए तो वर्कआउट नहीं कर रही है, that can also happen. Give it a try. Be patient with these activities also. Other than that, currently, if you are experiencing a lot of anxiety, and so some of anxiety is, I believe a lot of us are experiencing a lot of anxiety. But some of us are experiencing very significantly high levels of anxiety. Some of us are probably having a lot of panic attacks, जिसको बोल सकते हैं, या पैनिक बहुत ज़्यादा होता है, घबराहट बहुत ज़्यादा, हार्ट बीट बहुत तेज़ हो जाती है, and you're having it very frequently, maybe once a day or twice a day or thrice a day also. Then in that case, it would be advisable, if right now, if you want to seek help of mental health practitioners. There are many counselors and therapists out there who are giving online counseling. Some of them are giving few sessions, and they're doing it free of charge. They're giving free counseling to people who are experiencing anxiety because of COVID-19 pandemic situation. Other than that, there are of course a lot of therapists who take online sessions with their clients. So if you feel that you may need a therapist, you may need a counselor, or to help you in during this situation, it's perfectly fine. There is a lot of taboo against seeking mental health in our country, but thankfully in the last few years I'm finding many people are now increasingly approaching counselors and therapists and psychiatrists for their problems. And if you feel that it's getting out of hand for you, if you're not able to be productive at all, if you some of you may be even experiencing extremely negative emotions, especially given that diabetes in general tends to make you can make you feel very helpless and hopeless, especially for me. Like, I've been feeling a little low because I've always been able to let's say 5 out of 7 days in a week I've been able to manage my fasting sugar levels. But abhi man karta hai क्योंकि bore हो रहे हो, क्योंकि परेशान हो, क्योंकि feel खाना, so you'll probably eat a chocolate or chips, or you'll eat a lot of junk food, because that is another way of dealing with negative emotions. Eat good food, but that doesn't work for people with diabetes like us, तो वो counterproductive हो जाता है. तो I've been feeling a little not happy about my sugar levels, but I think I'm just telling myself कि ठीक है, कोई बात नहीं, अभी it's so I'm trying to get back into my exercise regime. I'm trying to get back into being active. So for instance, some people over here that Diya group mein, who are gym instructors also, I would say that maybe you should have a live session to tell people with diabetes what are some of the things that you can do on workout. Kya kaun sa workout, or what are some of the simple workout techniques that you could suggest that we could do at home to control our sugar levels. So if there are any other questions, please let me know. Otherwise, I will sign out. If you feel that you need to get in touch with a counselor or a psychologist, you can get in touch with me. I can refer you to some people who for help. And I can even provide you probably a list of people. Like I said, there are some people who are doing free counseling, so I do have a list of people who are providing counseling without any charge, pro bono counseling. So let me know, and you can follow me on my Instagram page also, which is Professor Drape. I can write that for you because I tend to share some information that may be of interest. Professor Drape, that is my Instagram handle. I can see you there. Okay, thank you so much for tuning in this Sunday morning. I hope this has been helpful for you. So feel free to give any feedback. Feel free to ask some other questions. If you have other questions, we can pick that up on maybe another time, another platform perhaps. Okay, see you. Bye.